Hello, I'm Julia Walters with Kingman Regional Medical Center, and you're watching our COVID-19 update series. Today, we'll be talking with Dr. John Ashurst in the Emergency Department and Sarah Schritter, Senior Director of Nursing Services. They oversee and run the infusion clinic for monoclonal antibody therapy for COVID-19. A note about how we're reporting numbers for this series. Starting today, we'll be reporting the previous week's testing numbers only. For total numbers of COVID tests to date, please visit our website at azkrmc.com. And now we'll go to Sarah with the update.
Hi, I'm Sarah Schritter, and I'm the Senior Director of Nursing Services at Kingman Regional Medical Center. I wanted to report out our COVID numbers for last week. Last week, we tested 592 patients for COVID, and of that, we had 71 positive test results. Today, in-house, we have 32 patients related to COVID. We have 29 positive patients and 3 non-infectious patients. Dr. Ashurst and I wanted to talk about monoclonal antibody therapy that KRMC is able to provide as an outpatient basis. We are very fortunate to be able to offer this service to our community to help fight COVID. We are one of the only facilities that can offer this therapy as an outpatient service in Northern Arizona. Dr. Ashurst and I want to extend a special thank you to all of our team that helped make this possible.
The treatments of COVID-19 have mostly been aimed at people who have been in the hospital. Just recently, within the last couple months, we have now had treatments that are now targeted for people with mild to moderate COVID to be treated on an outpatient basis. These include the new monoclonal antibodies. The important thing is to know what an antibody is. So an antibody is actually your body's a protein made by your natural immune system in response to an infection. So a monoclonal antibody is actually made in a lab, used to either enhance or to take place of a natural antibody to the in response to an infection. Yeah, so in this case, it's a little different. So the monoclonal antibodies that we use are a IV infusion. And what we know from the original COVID-19, the virus, it's the spike protein that actually helps the virus enter your cells. So these monoclonal antibodies actually bind to that area to prevent it from entering the human cells. Currently, right now, we do know that the monoclonal antibodies that are currently on the market, they do work against the UK, the new UK mutation that we are currently seeing. But in the future, it's going to be hard to tell because it depends on if those mutations and the genes of the virus change at that spike protein. The outpatient treatment of those with mild to moderate COVID-19, it's currently being reserved for people at risk right now. So what we say people at risk, so people at risk of being hospitalized or to have their disease get worse. So right now, what the FDA says, it's for age over 65, people with underlying health issues like diabetes, or people who are immunocompromised, history of hypertension, heart disease, or lung issues. The main thing that we see, according to the recent articles, is that the amount of the virus is actually less in people that receive it as compared to that who don't, especially in your lungs. And this is important because that is what we think causes you to be out of breath. And some of the other things that we have seen is that there is a decrease in the number of ER visits and people being hospitalized after receiving this treatment as compared to people that don't. So the main risks with the treatment with monoclonal antibodies, there are the allergies, and the risk of an allergy to the monoclonal antibody is between 0.1 and 1%, depending on which one is currently used. Those risks are relatively low. And then you have the non-allergy risks as well, such as nausea, vomiting, and loose stools. And also, you can get pain at the end. Since it is an IV, you can get some pain and irritation as well. So yes, so that is a common question that we get asked. So you can receive the COVID-19 vaccine after the infusion of the monoclonal antibodies. The current guideline is to wait a total of 90 days after your infusion. And the reason is because there's no current data on the efficacy of the COVID-19 vaccine in people that have received the monoclonal antibody.
We have a dedicated team that screens all COVID positive patients that have been tested at Kingman Regional Medical Center. Our physician then calls those patients that qualify for treatment and offers them therapy. When they get therapy, after that, the central scheduling team will call them and give them a scheduled appointment time. Once they get to our infusion center, the whole process itself takes about 2.5 hours. The first half hour, we insert the IV and we go over some information, including a patient education and fact sheet. After that, the infusion itself takes 1 hour, and then we watch the patient for an hour after that to monitor for any signs and symptoms of an allergic reaction. If you have a test outside of Kingman Regional Medical Center or have any questions regarding the therapy clinic, please give us a call at 928-681-8699.
As always, if you have symptoms of COVID, please use our online telemedicine platform, Care Anywhere, to complete a virtual assessment. For more information about COVID-19 in our community, visit azkrmc.com/COVID-19. Until next time, stay safe and healthy.